Hello, everyone, and welcome to our ISPCAN monthly webinar. My name is Jane Estes, and I'm the ISPCAN Knowledge and Content Development Manager and moderator for today's session. Also joining us online are Holly Malcolm, our ISPCAN Membership and Marketing Manager, and Pragathi Tamala, ISPCAN CEO. ISPCAN International webinars are always free of charge and cover diverse topics which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help our members and partners gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve outcomes for children globally. And we're excited to introduce to you our newest project, The Huddle, ISPCAN's new virtual training model. If you're a practitioner working in child protection from any sector, then this special online training is an incredible opportunity for you. ISPCAN will bring together virtually multidisciplinary experts from diverse regions who will all examine a case study involving different forms of child sexual abuse each year. Using this online study format, each discipline will evaluate the role that it played throughout the case, and they'll come together to determine what could have been done differently to ensure a more successful collaborative response. This year's huddle will take place in May with 90-minute sessions each week. It'll be free to ISPCAN members, and registration for the huddle will open in March. The specific topic for this year's huddle: strengthening interdisciplinary strategies to address child sexual abuse. Insights from the film Rewind by survivor Sasha Neulinger. Multi-generational child sexual abuse in the context of culture, family, and systems of care will be explored. How the medical, mental health, and justice systems interact to protect and heal the child will be deeply examined. From the eyes of the child, we'll hear the case as it unfolds using Sasha's home movies as he recreates and tells his story. On your screen now, you'll see the really impressive group of multidisciplinary content experts who developed the curriculum and will lead the virtual case study. Please visit our website for the full huddle concept note. Also, we hope that you'll join us in the beautiful city of Vilnius, Lithuania, for our International Congress, October 6th through 9th, where we'll bring together the brightest minds in child protection from every sector to innovate and share best practices. Join us in this beautiful country as we keep pushing the boundaries of research and practice to ensure that all children have the chance to thrive, no matter what their experience. On your screen now, you'll see the themes for this Congress. And please know that abstracts are open till February 25th, so we hope that you'll submit. And because we believe you should have access to all the information and resources available to support you in your work, we encourage you to visit our ISPCAN Knowledge Hub. The Knowledge Hub is an open access, centralized library containing ISPCAN and impactful partner resources. This user-friendly hub has our webinars, journal clubs, masterclasses, data-driven global reports, and shared partner and downloadable resources. If you have an open access resource or program that you would like us to share in the ISPCAN Knowledge Hub, please email it to me at partnerships@ispcan.org. And we are so thrilled that you're here with us today, and we want to share some tips for making the most of today's session. Just please engage with us. This is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We're going to use your questions right at the beginning of that part of the session, immediately at the conclusion of the presentations. To enhance your experience, you can enable closed captioning from your Zoom control bar by choosing Captions. And as always, for joining us today, a recording of this session, the panel discussions, links to the featured resources will all be sent to you after the webinar. And now please take a moment, introduce yourself to other attendees, our ISPCAN team, and our featured presenters in the chat box. Let us know where you're joining from, your organization, and your discipline. And now today's topic, in partnership with Spring Impact, demystifying how to scale solutions. Preventing violence against children and ensuring their protection is a critical issue which requires impactful solutions that can meet the size of the problem and address it at scale. But what does it truly take to scale up effective solutions and interventions? This interactive webinar combines expert insights from Spring Impact, practical tools and frameworks, and a conversation with leaders from organizations already in their scaling journey. Whether you're weighing up if scale is right for you or looking to redefine your approach, you'll receive actionable guidance. What do you need to get started? And what are the mindsets you need to adopt to progress successfully? Specifically, our key learning objectives for today's session are to understand the difference between scale and growth, and what scaling truly entails, and how to evaluate whether your solution is impactful and effective enough to scale, and to identify key pathways for sustainable scaling and what the most relevant options for your organization might be, and to learn the crucial mindsets for scaling up, including prioritizing the problem over the solution, being ruthlessly strategic, and embracing collaboration. And now to meet our presenters. Amy Cuffley. Amy is a senior programs manager at Spring Impact, responsible for leading the setup and delivery of several multi-year programs focused on training, consultancy, and learning exchange for mission-led organizations to scale their impact. This includes programs focused on preventing childhood sexual violence, women's empowerment, and supporting children to thrive within families. Amy first joined Spring Impact as a senior consultant, where she worked directly with NGOs and CSOs from across the globe to develop the mindsets, strategies, and operational approaches needed to reach more people in more places. She brings firsthand knowledge of scaling the impact of initiatives, having joined Spring Impact from the UK educational charity Future First, where she worked as head of primary school services. During this time, Amy established and scaled Future First primary school program. And Anna Avaska. Anna is an international child rights law specialist dedicated to safeguarding the rights of children in online and offline environments. She focuses on addressing crimes against children and cross-border offenses, with a strong commitment to prevention and advocacy. As Deputy Director and Legal Specialist at Protect Children, Anna works on raising awareness, conducting research, and advocating for early prevention strategies to combat child sexual violence. Her efforts include offender and potential offender-focused prevention, aiming to address harmful behaviors before they escalate. Anna leads the expansion of the Redirection Self-Help Program, an innovative initiative designed for individuals at risk of committing online sexual abuse who are motivated to change their behavior. And Godfrey Sue. Godfrey is a behavioral and public health scientist and senior lecturer at Makerere University Department of Child Health and Development Center in Uganda. He currently leads the Families, Parenting, and Child Health program at the department. Godfrey has led the development of a homegrown, evidence-based parenting program, the Uganda Parenting for Respectability, which is being scaled up in parts of the East African region. Godfrey has led and supported the Uganda government national efforts to standardize parenting work by setting up the Uganda National Parenting Agenda and developing national standards for parenting programs in Uganda. He is currently leading efforts to implement a training course on the science of evidence-based parenting interventions to build the capacity of Ugandan practitioners. And now it is my honor to turn the session over to our presenters.
Thanks so much, Jane. Really appreciate that, and welcome everybody. Really looking forward to spending time with you this afternoon and digging into the concepts that Jane just outlined. I'm going to just share my slides here, so hopefully you can all see them in full screen. As Jane mentioned, my name's Amy, and I'm joined by two of our lovely panelists, Anna and Godfrey, and also partners of Spring Impact, as we've been working alongside one another for a period of time, thinking about how to support them to scale up their solutions. So before I share our agenda for today, I just wanted to share a little bit more about Spring Impact. So we are focused on kind of one sole mission, helping organizations across the globe to create impact at scale. We know that there are many meaningful and impactful solutions out there aiming to address some of the world's biggest problems. But we also know that very few of these ultimately end up kind of achieving scale. And our mission is to change that and really help organizations answer the difficult questions that they face, some of which you might be resonating with that are on the slide here. And so about Spring, we are a nonprofit organization ourselves, and we work closely with other nonprofit and mission-driven organizations through consultancy, training, free online tools to help them think about how they can address the world's most pressing problems at scale. Over the past 13 years, we've worked with more than 350 mission-driven organizations through our consultancy and support in more than 50 different countries, and a further 600 organizations through our training offers. And then, as I mentioned, we have a suite of different methodologies and tools used to support organizations freely available on our website to suit you kind of wherever you are in your journey to scale. And so today, with the help of Anna and Godfrey, we're going to be having a mixed approach to this session. I'm going to be sharing and exploring a little bit more about these three concepts: scale versus growth, and how Spring Impact defines scale, scale readiness, and how to know if your solution in your organization is ready to take those first steps to thinking about scale, or how to really enhance your scalability. And then thinking a little bit about what are the different pathways and approaches available to create impact at scale. And the session will run with a little bit of me giving kind of a concept background, and then inviting Anna and Godfrey to chat more through discussion about their experiences and how this is playing out in the real world. So as we get started, I'd love to ask you to share in the chat, maybe what does scale mean to you, as I then talk through the scale versus growth concept and how we see scale at Spring. And so at Spring, we define scale as dramatically increasing the impact of a solution to better match the size of the societal problem an organization is working to address. For example, addressing ending childhood sexual violence. And we see that differently to growth. And to kind of illustrate that better, I'll show growth and scale side by side. So we tend to see that if an organization is growing, it's adding resources, so staff, securing more funding, roughly at the same rate as it increases its impact. The number of people served or the impact created is going up year after year, which is great. But when you look at the impact against the size of the societal problem, which is the yellow line along the top, the impact isn't actually that large. And if an organization is continuing to create that impact at that same rate year on year, it would actually take decades to close that gap, if at all. But when we look at scale, what we're really interested in is increasing impact at a rate that is much greater than the resources invested and better meets the size of the problem. We're interested in finding ways to reach hundreds, thousands, or millions of people that are currently not being served. And this involves often taking a step back and thinking fairly strategically about how to meaningfully put a dent in that problem, which normally means doing things a little bit differently, coming up with new ways of working, finding new partnerships, finding different ways to deliver existing solutions so that an organization can impact way more people with the resources that they have. So to sort of show that visually, we see scaling is about closing that gap, sort of this unmet need between the solutions that exist and the problem as it currently stands. And there are three ways that we generally say that this can happen. So one can be changing the system to reduce or solve that problem. Another can be increasing the number of solutions and the solutions available to match that size of the problem, or doing a combination of both. So that's, I guess, to give us all a grounding in how Anna, Godfrey, and I are interpreting scale, how Spring sees scale, and what we mean by scale when we're talking about it today. What I'm going to do now is hand the floor to Anna and then to Godfrey to just share a little bit more about their respective organizations, the solutions that they're scaling at the moment, and their current reaches. So Anna, I'll pass to you first.
Thank you so much, Amy, and thank you, Jane, for the lovely introductions. And I'm so honored to be here today representing Protect Children. My name is Anna Ovaska. I'm Deputy Director and Legal Specialist here at Protect Children. We are a small but mighty Helsinki-based organization focusing solely on the prevention of sexual violence against children. I've been sort of leading our scale journey for the past year with Spring, and it's been such a wonderful learning experience for myself, and I'm really excited to talk more about that today. But just briefly about our organization, we've been established in late 2019, 2020. Like I said, based in Helsinki, but we work very internationally. We've got a team of about 10 people, but as we'll talk today, that hasn't kind of come in our way of scaling successfully. Our focus, as I said, is preventing all forms of sexual violence against children. We do that kind of through three main channels. We advocate and we amplify the voices and the wisdom of victims and survivors of sexual violence, as well as their families. We support and we serve, again, supporting and serving victims, survivors, and their families. And then finally, we prevent. So we educate children, we educate professionals, and then we focus on offender-focused prevention, which is what our solution is focused on. So just briefly about our solution, it's called the Redirection Self-Help Program. It is a self-help program for individuals who are searching for and viewing child sexual abuse material online. It's a fully anonymous program, which we'll be kind of talking more about today. So that's our solution. And thank you so much again, Amy and Jane, for having me here. Thank you.
Thanks, Anna, and Godfrey, I'll pass to you.
Thank you. My name is Godfrey, as introduced, and I really want to thank Jane for that very detailed introduction. So I'm not going to say anything more about myself, but just to say, hello, everybody. I'm so super excited to be here this afternoon, evening in Uganda, and I want to say thank you so much for the opportunity to be here today to share practical experiences of scaling up a model that we have grown for over 10 years. I work in a university department, Child Health and Development Center. We do teaching, we do research, we do community service, as well as capacity building and training. Our department is multidisciplinary. We have a mix of clinicians as well as social and public health scientists, and together we develop solutions and we scale them up. My department is one of the few that has pioneered work in the area of families, violence, and child protection, and we are extremely excited to be sharing our experiences. So one of the solutions we have designed in the last 10 years is called the Uganda Parenting for Respectability program, which was designed to address the link between violence against children and spousal violence. And so the program addresses that link, and it draws on a theory that seems to be relevant to African settings, particularly families in Uganda, that is respectability, which is a central organizing principle around family life and relationships. The parenting program is unique because it has a very strong focus on male engagement, which continues to be a major problem and challenge for most organizations and programs. We also focus on deliberate recruitment of spousal couples in the program so that they learn together and deepen their understanding and clarifications of conflictual perspectives in the area of parenting. We do currently work in a number of countries through our partners. We are in Tanzania, we are in Kenya, and more recently, the program has been scaled up, is being scaled up in Ethiopia. And in Uganda, we are in several districts currently we ourselves, we involved in the scaling up together with the partnering with the Ministry of Gender, Labour and Social Development and the district local governments. But we also have other partners who are doing scaling with a department playing sort of a not very active role, but rather as a capacity building expert for the program. So thank you so much for the opportunity. Looking forward to more discussions later.
Thanks so much, Godfrey, and thanks again, Anna. And so the first concept that I wanted to dive into is, and as Jane alluded to in the kind of objectives of this webinar, wanted to share a little bit more about scale readiness and what that might mean, and when you might know if you're ready to embark on the journey to thinking about scale, or what you might need to be tweaking and enhancing to be able to be really successful at scale. And Godfrey and Anna will be able to also share more about their experience as well. Scaling essentially requires preparation across a range of areas of your kind of solution that you're wanting to scale, and also the organization that's holding that solution. And one of the things that we talk about is called the sweet spot for scale. And in order to scale successfully, we believe that organizations need to be able to hold these three different criteria successfully and really hit that sweet spot in the middle. And so the first thing that we say organizations really need to hold and value and think about is value. The solution needs to be valued by the people that it's meant to benefit, by the people that are involved in delivering it, and also those that eventually may be paying for it if they're someone else. Will they want it? Will they continue to engage with it over time? So even if the solution works from an impact perspective, if people who are supposed to be benefiting from it or kind of delivering it don't show up or don't use it, it's actually largely going to be useless. So we really need people to value the solution in the first place. And then impact is what we suggest is most important. We need to be sure that our solution is making a meaningful difference to the people that it's intended to benefit, and be making a meaningful difference and making a dent in the problem that we're looking to solve. Does it actually make people's lives better? Does it help to address that societal problem? Is it creating lasting change? And has this been validated in a way that's proportionate to the solution that we're delivering? And then finally, sustainability. So once we have a solution that's valuable, that's impactful, we need to think about how to get it to as many people as possible year after year. We need to understand what the costs are and where the resources are going to come from to cover these costs. And the reality is that if a solution is not sustainable at a small scale, it's likely to be even less sustainable done process. This is going to be something that iterates year after year, and as you learn more and you test more and you experience more things as you embark on your journey, and you might be holding one more than other at different points. And so then linked to the sweet spot but slightly different is taking solutions to scale can be, as I said, a lengthy and expensive process, but it's important to ensure that you're prepared for this journey and aren't going to kind of waste time and resources by not having some of these things in place in advance of really embarking on thinking about scale. And so when we're thinking about scale readiness and reaching that sweet spot for scale, we encourage organizations to explore how ready is your solution, your program, your intervention, your service, your thing that you're taking to scale, and then how ready is your organization to lead that process and hold that solution during that process. And hopefully Holly from ISPCAN can share in the chat. We have a scale diagnostic tool available freely online to work you through kind of lots of different questions to analyze where you might sit in this framing and what you might need to think about to enhance where you're at in terms of solution readiness and organizational readiness. And to just capture some of the areas that are explored in that diagnostic and that we work with organizations to really understand when first embarking on a journey together. The yellow are those solutions, readiness ones, and the green are organizational readiness, and these are the kind of key themes that we consider. I'll pull out a few now just to give examples. But yeah, do really recommend you taking a look at that. So the first one here on the solution side is problem. We can't solve everything for everyone. So knowing what part of the problem we as an organization and a solution are choosing to address, and knowing why we're best placed to tackle that alongside others is really important. What is our role in solving this problem? What is our like niche laser focus in really making a difference and a meaningful dent? And what are we not doing? And what are others doing well is really important to understand at the outset of a scaling journey. Impact, I've touched on this importance kind of already, but really understanding and being able to evidence the positive outcomes that you are seeking to achieve will allow you to identify which parts of your solution are really, really crucial to scale and ensuring that impact is happening time and time again and creating this change, and actually what might not be needed to help you streamline as you scale. Also be able to help you articulate your contribution and how you're addressing the problem really effectively in conversations with key stakeholders, in applications for funding, in your overall strategies. And also start as a sort of starting point for developing your scale pathway, which we'll touch on a little bit later on. The level of evidence, though, required to kind of prove the impact of a solution, especially when sort of setting out on a scaling journey, will really differ based on what your solution is, the level of complexity, the sector that you're working in, information that might be needed by kind of funders or others that implement alongside you. And then on the kind of operational side, I'm just going to pull out scale lead, because I think this is sometimes something that's overlooked when organizations are first thinking about scaling or in their scaling journey. Successful scale is not something that just happens. People are really, really important in driving successful scale. So it really requires kind of targeted, thoughtful, and well-resourced approaches to scale successfully. And you typically need someone with the skills, the capacity, the dedication to champion and prioritize the kind of scale journey of what you're wanting to scale, the solution you're taking to scale, internally and also externally. So to kind of stay the course with it. I'm going to stop there, though, sharing the scale readiness concept, and take my slides down. I'd love, though, for you all to pop in the chat anything that you're kind of considering as I've shared this that you might change or adjust to enhance the scalability of your current work, whether that's kind of impact, value, or sustainability, or something in one of these themes. And I'm then going to, as I said, stop my share currently, and then take some time to chat with Anna and Godfrey about their experience of embarking on their scale journeys. And I think maybe I'll come to yourself first, Godfrey, and ask you, I know it's been 10 years, so maybe it's really casting your mind back, but what helped you and the team at CHDC decide it was the right time to embark on your scaling journey? And I guess adding to that, how did you decide that you were ready in terms of parenting for respectability, having kind of enough impact to justify going on this journey?
Thank you, Amy. Once again, I hope that our experiences will be valuable to someone. And if you already in this journey, we'll be also happy to hear from you later on, and I'll be keen to read the chats as well. So we developed a solution on violence prevention, on parenting, at a time when the government and international community was beginning to pick a lot of interest in designing parenting interventions. But at this time also, there was a major challenge in this part of the world, in sub-Saharan Africa particularly, where there's limited evidence of homegrown intervention. So when we started the Parenting for Respectability, we knew we had hit it because we designed it locally and based on a theory that was quite relevant, I think, to the needs of different stakeholders. And so we embarked on piloting the intervention, and within a few months, actually a few years, there's a lot of interest from government, from partners, from lots of people. They're saying, it seems this is working, but being a research institution, we knew that we needed stronger evidence. So the inability to tell what level of evidence is required for us to be able to let go and say, let us now begin scaling up, was sort of a barrier. And therefore, we hesitated even when there was demand for the program, but we had to start thinking about the need for scaling. And I really thank Spring Impact because it was quite timely when we started working with you. That is when we started to appreciate what scaling up is and what is actually needed to begin a scaling up journey. First thing that struck me was that you cannot do a solution and go through all stages of intervention, development, testing, and come up with all the rigorous research and evidence without thinking about a scale-up strategy. So it was so important that we started thinking about a scale-up strategy even before we completed the rigorous studies that were necessary to sort of avail the solution. And that is when our scale-up journey began. I don't know if I'm answering your question, but you could let me know if there is anything else you would like me to see.
You definitely are, Godfrey, and that's really helpful. And maybe I'll send it to Anna and ask a similar thing. I know that Protect Children are slightly earlier in their journey and not been scaling for as long as CHDC, but would love to ask a similar thing. What helped you to say yes, we're going to go for it, and what are you learning, I guess, as well?
Thank you so much. I mean, for myself personally, it's been quite tricky to grasp the concept of scaling to begin with because we didn't have any of that background in our organization. But I think the first kind of thing that we had to understand is we don't have to be huge or established for decades and decades in order to start scaling our product or our concept. So like I said, we're about 10 people. We've been established 5 years ago. So kind of speaking with Spring, we understood these concepts. We don't have to be huge. We don't have to be established for ages in order to still spread an idea that's worth spreading. We also noticed that there was just simply a huge interest for our service, our program, which is the intervention tool for people searching for child sexual abuse material. And just in general, I feel like we're at a moment where there is just a clear need for further resources and further solutions globally to address the issue of sexual violence against children. So it was really something that we just sort of we trusted Spring with, and we decided to take a leap of faith. And I'm really glad we kind of started this journey, and it's been such a learning experience for us. And like you said, Amy, it's been about a year that we've been on this journey. I mean, it's not very long, but it's definitely been very, very worthwhile.
Thanks both. And I suppose you've both spoken about this point of demand and people really valuing and seeing the importance of your solution, like unlocking the point at which knowing you need to take the next step to be able to meet that. So that's really helpful to hear. I'd be interested to also open up, I guess, Anna, maybe to you first, as it's more fresh, but kind of what are some of the challenges or mindsets or different approaches that you've had to adopt as you've been thinking about scaling that are maybe different to what was once business as usual, maybe?
Well, like I said in the beginning, we didn't have any sort of background in scaling, and even just the concept of scaling. We've been learning so much in this past year, so things had to be done a little bit differently than we'd normally do them. So I mean, the whole journey, it's been testing and then trying again and trying something differently and kind of tweaking things, finding the pathways that work, finding the ways that we approach people that work. So I think that it hasn't been as fast as you would maybe hope for sometimes, but it's been such a learning experience. And I think also things like attitudes when it comes to our topic specifically have played a huge part in our scaling journey, and that's something that we've definitely faced some challenges with, talking to people from different cultural contexts, different countries, different backgrounds. It is a tricky topic, focusing on offender-focused prevention. It can be tricky. So that's definitely been something that we've had to approach in different ways when it comes to different situations. Yeah, so that's just something that came to mind.
Thanks, Anna. And then similarly, Godfrey, I guess encouraging you to kind of look back to the start of your journey. And do you think that like timing of scaling was ideal? And that's not meant to be leading. I'm interested. And I guess what have you learned about, in retrospect, what you needed to have in place and what you've been putting into place as you've scaled and you've worked across borders with other partners? Yeah, I'm interested to hear a little bit about that.
Okay, so thank you very much. And just to start from the kind of challenges and barriers that we had faced, the first one was actually really about mindset and, you know, about the kind of evidence that was necessary to accept that this solution can now be scaled up. As a research institution, we are very committed to building this rigorous evidence. So we had been doing research for quite a lot of time, but we're still waiting for RCTs, which of course we know or we assume are the gold standards in this kind of work. But there was demand for the program. People are dying, people are facing challenges, problems with parenting, and government is asking for solutions. And so we had to overcome that and say the solution is there. It's not fully proven. We don't have all the evidence on this world that we need, but some evidence is there that it works. And so having to balance that and to start to listen to the demand. But of course, this was not irrational demand. These are also experts. These are government. Government has some of the most technical people. And so they understand some of these things. They're not just demanding for a solution that is going to risk harming people. So that's the time we started to say, okay, maybe we should relax a little bit and begin to allow some scaling up to happen as we build a scale-up strategy, as we listen to the stakeholders who are using the program, and as we build from the experiences. So in essence, this is what I call building the plane as you fly it. Quite risky, but also necessary at times when you think you have something really exciting and useful. So that was the main challenge we had. And we also feared, you know, will the implementers, for example, maintain the quality? So we're thinking about things around fidelity, the need to build capacity. And we didn't have this capacity ourselves to do all these things. So what does it take to start a scale-up journey? Again, thanks to you, Spring Impact, because when we started working with you in 2017-18 is when we really appreciated that we must have a scale-up strategy right from the design stage of the intervention. And that's really helpful. I hope that it resonates with everybody. Building a replication model is absolutely key. And we, in that replication or scale-up model, we began to make so many assumptions about the interventions and about the solution, about who is doing what, who is likely to be interested, you know, profiling the stakeholders and who might need this solution and why. Asking that, why would, for example, government be interested in the Uganda Parenting for Respectability program, and trying to deal with potential risks.
Thanks, Godfrey. I feel like we might have just lost connection there, so I'm going to just mute you in case, or actually ask Jane if you can just mute Godfrey in case he does re-find connection and it's mid conversation. I also wanted, and Anna, this has been a question that's come up in the chat and also in the Q&A a little bit, but is to ask you, and Godfrey, if you can hear me, I'd love you to add your input if. Oh, can you hear me okay? Add your input if you're able to. But I'd love to hear a little bit about how you're also thinking about not only kind of demand and the impact of your solutions, but also sustainability at this point in its journey. So that could be sustainability in terms of having the staffing structure, but also like financially into the future? What are some of the things, Anna, that you're maybe thinking about at the moment as you're taking this journey?
Yeah, so I mean, through our year with the Spring, we've learned a lot about the different pathways to scale. The pathway that we're most focused on right now is identifying suitable NGOs in different countries across the globe, essentially who are interested in offering our solution to the people within their region or their country. That's sort of how we envision the sustainability, is basically through a subscription model of our tool, whereby our clients will be purchasing the license to the tool 1 year at a time. And that again is something that is one of the ways that we've learned that might be the most suitable one for us. But we're also been sort of exploring in the government scaling pathway as well. But I think Godfrey will be better suited to answer that one.
Thanks, Anna. And Godfrey, I'm not sure if you caught the end of my question. You're currently on mute, so you'll need to unmute yourself. But I was just asking Anna and yourself to reflect on sort of what are some of the things that you're thinking about in terms of sustainability, both I guess financially, but also in terms of like longevity of your solution, being able to have the people and capacity to deliver it as well.
Thank you very much. I think sustainability continues to be a major concern, major worry for all program developers, and especially when you're scaling up. And we have been confronted by this challenge, not least because we are an academic institution. We don't provide funding. We don't have our own resources. So important to really think about the kind of partnerships and the kind of models that can allow the program to be scaled at a sustainable way. One thing that we are working on right from the start to ensure that it could be sustainable was to start working with an implementing partner in mind. So at the design of the intervention early on, we invited an implementing partner to work with us. As we do the research, they are trying out elements and seeing how that could work and what it takes to work. The second was also to do with government, because we think that government is perhaps the best structure, because their government is everywhere and they have structures. So we worked with the government officers from the relevant line ministry to as advisory committee members in the project initially, and now we are working together to scale up. And what we see is that the government structures right from the ministry can do support supervision. At the district local government, they can run implementation. But generally, funding remains an issue and needs to be thought about by different partners.
Yeah, definitely. Thanks, Godfrey. And I think exactly as you're alluding to, there's no sort of silver bullet or direct answer to finding the perfect sustainable funding route. What I wanted to actually just pop in the chat, as I think it will be helpful for some of you there, is that Spring Impact, it's a report we've just recently launched about securing nonprofit funding. We interviewed 28 organizations, mostly in lower and middle income countries, and who are operating at significant scale to understand how they're funding that and what that's looking like. And there's a real mix, and often people are using a real diverse range of funders, from big philanthropy to end user payments to kind of government partnerships and other things. But definitely worth a look if that's something you're interested in and exploring. Anna, Godfrey, I'm going to pause our conversation here and open up our next concept of, as we've started to sort of allude to that scale pathways, scale strategies. And I think that will then allow people to learn a little bit more about what we're talking about, and us to have a bit of a richer conversation about that as well. Can I just confirm you can hear me okay? Because my headphones seem to unplug and replug in. Super. Okay. Let me get the slides up again. And share a little bit more about our scale pathways. Here we go. Let's check that you can. Oh, sorry, technical difficulties on my end. Here we go. There we go. You should be able to see that now. But as Anna and Godfrey have been alluding to, we encourage organisations to think about scaling at the outset of delivering a solution, and really thinking about how can we ensure that this solution is making a real meaningful dent in the problem that we've set out to solve. And there are many different ways to scale up solutions, and many different ways to kind of change a system to really make that meaningful dent and reduce the size of a problem. And so what I wanted to just share on the slide is the pathways that we've found to be most common for CSOs, NGOs, and mission-driven organizations to use to help them to scale up and think about how to reach as many people as possible in many different locations, or deepen their impact in a particular location, or change a system to really ensure that they're solving a problem. And so on the left, in that kind of greeny blue, are pathways that create kind of widespread delivery of solutions, services, products, practices. And then on the left are pathways that scale impact by changing systems, cultures, societies, in order to kind of reduce the problem. And if you remember back to the slides at the beginning, there was the kind of problem getting smaller, and the graph with the solution getting bigger, and it was the 3 graphs in a row, and then there was the option for the combination. And just to share and reiterate what Jane said, at the moment, all of these slides will be available online after this, so you can go back and look at it too. But the different types of pathways, those in green and those in yellow, have different trade-offs in terms of the level of control and oversight and kind of quality management that you're able to have as you deliver a solution. And Godfrey alluded to that a little bit, but also the speed and cost at which you're going to be able to scale, and then who might be kind of doing the doing and paying for a solution at scale. And then different factors will impact your choice of pathway, such as like the problem you're trying to solve, the complexity of your solution, the context and ecosystem within which you're working. And we often find that actually organizations don't kind of pick one, say training and tools, and that's all that they do. They end up working across a few different avenues, or trying to hold kind of ongoing widespread delivery alongside a little bit of kind of influencing of public policy, for example. And before I hand back to Anna and Godfrey to chat a little bit more about how they've been scaling, what they've been learning, and their approaches, I thought I'd just share a couple of examples that are different to the journeys that Anna and Godfrey are taking. And so many of you may have heard of and met Centres d'Adetse at ISPCAN conferences before. They're an NGO based in Latvia that work to train teachers across schools and kindergartens to deliver a curriculum that prevents childhood sexual abuse by improving children's self-esteem, confidence, knowledge of safe touch, and like ability to diagnose incidents or unsafe behaviours that they're experiencing at home or in other settings. And their programme also enhances the skills of adults to be able to action like incident referrals to them and kind of deal with receiving disclosures. And Centres d'Adetse, they have been scaling this across Latvia. They're working in a huge majority of kindergartens and schools in Latvia now, since we worked with them a good number of years ago. And they've been scaling this by training, as I said, those teachers and kindergarten agents to deliver their programme on their behalf. And those teachers get an initial training, and then they receive annual refresher training and opportunities to come together for the big conference events and things like that. And they get given a handbook of all of the curriculum and guidance materials. And the advantages for Centres d'Adetse of scaling in this way is actually that this is a fairly cost sort of sustainable solution, because schools and all their local municipalities are paying to receive the curriculum and training. And that was a big change for Centres d'Adetse. Originally, they were offering the programme for free to municipalities and schools, but they realised that this was a really important aspect of the curriculum that wasn't currently being served. And municipalities really understood the need to have this as part of the curriculum offered to children in their locations. That was not an easy initial journey. It did involve working with municipalities that Centre Students they already had good relationships with first, and having like lots of different conversations to get to a point where municipalities are funding a number of schools in their settings, or schools who have the budget are funding this themselves. Another advantage of this kind of training approach is that they're able to reach a very vast number of children year on year with like limited internal capacity themselves. So they still have a very small kind of core team at Centres Dad, say, who are in charge of like ensuring that curriculum's up to date, monitoring that the delivery of that is effective in all of the schools, keeping people kind of refreshed and the impact high, but less doing all of that delivery. I guess though the flip side of that is that they do have to have sort of strong quality control mechanisms in place. And so they have had to really think through kind of about what does that look like? How often might they go and see teachers delivering this in schools? What kind of support and helplines need to be available for teachers if incidences are referred that they don't know how to deal with? So they've had to think quite creatively about what their role looks like when they're in the quality management position rather than in the kind of delivering of the training position. I'm going to share one other example, and then I'm going to open up back to Anna and Godfrey to talk more about what they're doing in reality. But I'm going to talk about last mile health, which is more around kind of changes in society, culture, influencing the kind of system within which problems exist. And I think you may well have heard about Last Mile Health, but they are an organisation that supports countries, particularly across Africa, to build teams of health workers to deliver healthcare to the world's most kind of remote communities. And their work and impact in Liberia specifically has influenced the government to change their model of paying for community health workers as contract workers now, and to really train them in the knowledge and skills needed through like a long-term national kind of health community health program, and to really ensure that they're fairly paid, fairly trained, and able to work in these remote settings. And this has also kind of led to a change in policy. But they've been able to influence this by showing the success of them initially setting up an approach like this. And now nearly 5,000 kind of community and frontline health workers are being recruited and deployed into these areas. And so I guess for Last Mile Health, this is an approach that they're now adopting in a number of different locations. So showing the need, showing the success, and then lobbying national policy to take on this approach and understanding why the investment is successful. And this has a vast impact on kind of being able to reach like national scale and sustain national scale and create kind of a more enabling policy and legislative environment to solve the problems that they're looking to address. But I'm talking about this like it was a quick overnight thing and really easy. The disadvantages of taking kind of, I guess, policy influence as your sole aim is that it's a lengthy process to get kind of public bodies to recognise and adopt new ways of working, and it requires a lot of motivation for the team to face different challenges and barriers and continue to persist and stay motivated and keep going. And as I'm sure you would all know, that like advocacy, campaigning, influencing national governments involves different skills to being a kind of a program manager and a deliverer of a solution. So that's also important to note when thinking about the different ways that you might be scaling. Some of them will really involve different ways of working to what you might have first set out to do, and different skills to what you first had amongst your team. But yeah, I'm going to pause there, and I'm going to stop sharing my screen. I will also look in the chat in a moment because I know there are different things coming in there, but I wanted to, as I said, put the floor back to Anna and Godfrey. And actually, I've just seen something come up in the chat. And again, if you go onto our toolkit online, and I think Jane might have a link to this that you'll be able to pop into our chat, we share kind of a detailed breakdown of all of those different pathways that we popped on that slide, with advantages, disadvantages, and kind of sort of thoughts around like why this might be suitable for you and your organization. Sorry, Anna, that was a segue. But yeah, I'm going to open the floor back to Anna and Godfrey. And Anna, maybe start with you, but I'd love to keep it fairly broad and maybe ask you to share a little bit about what your journey to scale is looking like. What are the things that you're doing, you're learning, some of the successes you're having as you're kind of embarking on thinking about scale and what's next for the Redirection Self-Help Program and taking that beyond Finland as well.
Thanks a lot, Amy. Well, first of all, I think when it comes to just the experience of scaling, we started off, like I said, with not having much of a background and also not really knowing what we need to have in order to successfully scale. But what we did have was a good concept and a good product, so the Redirection Self-Help Program. And we kind of, like Godfrey was saying as well about evaluating and conducting RCTs. I mean, we had collected feedback from actual users of the program. So we have over 200 individuals who have used the program, given us direct feedback, and we had some preliminary sort of positive results there. So we know that, or we at least hope that the program is, useful before we delved into this further. We then have now embarked on 2 separate RCTs to actually conduct scientific evaluation of the program as well, and results will be coming out hopefully very soon. But when it comes to then starting the actual scaling process, I mean, it's been trial and error. It's been learning about what it means to scale, how we can scale this specific product. And like I said, this context is a little bit trickier because of the nature of the work and the tool. I think what's been really interesting is learning more about how we can try something with very light touch. We don't need to invest a lot of time or money or effort into it. We can try it and then we can see perhaps that wasn't the way to go, and then we can redirect our efforts. I think for us, it's been really important to know our audience. And like I was saying earlier as well about the cultural contexts and the different sort of viewpoints when it comes to prevention of sexual violence, specifically the offender-focused kind of leg of the efforts. We don't want to try and go into a space or country or context who really don't yet, or who haven't yet kind of embarked on the offender-focused side too deeply. So we're trying to maybe find more like-minded NGOs first instead of trying to go straight to governments. But I mean, it's been really interesting for the past year to try to learn more, and it's been a lot of back and forth. I mean, Spring has been so helpful. Once more, thank you, Spring. But I think, yeah, it's been really, it's really important for us to understand our audience. So to find those NGOs or those actors in the different countries who would be interested in taking our solution on board.
Thanks, Anna. That's really helpful, and I think some of those points have clearly really resonated in the audience as well. Godfrey, I'd love to talk to you about how we know that Parenting for Respectability has scaled kind of extensively since its inception, and much of this has been through collaboration and working across borders. I've seen that there's been like a few questions about scaling in partnership with government, so wondered if you could maybe talk to that a little bit, as well as your scaling journey more broadly.
Okay, thank you again. Our scaling journey has been quite exciting, actually. It's one of the best things that is happening to us, and we are also super excited all the time. Like I said, first of all, we lacked an understanding of what it takes to scale up, and we lacked a scale-up strategy. Now, the purpose of the scale-up strategy that we developed helped us to clarify a number of things. One is the mindset regarding when are we ready, or when do we let go and how. We identified the essential components of the intervention and how we might engage with it going forward. We identified the different roles. We did profiling of different partners, including government and their roles, and why each one of them might be interested in the PFR, Parenting for Respectability program. We clarified our readiness to scale, in short. We came up with lots of assumptions, including sort of a financial model where we said, if this, then it could be this, and so on. And this meant that when we started to look up for partners, or when partners came, we were able to look and check their capacities and what is their niche, what is our capacity, what's our niche. So for some organizations, we remained a technical partner who only provides technical support and training. That is the kind of relationship we have with CRVPF, which is Child Rights Violence Prevention Fund. They are some kind of intermediary. They don't implement programs, but they fund. They provide sort of small funds ranging up to 200,000 or less for CBOs and NGOs operating at local level. And they have a very interesting model where they work with clusters. So they provide funding to a group or cluster of organizations working in one area. And CRVPF is working in Tanzania, Kenya, and Uganda, and Ethiopia. So that model allowed the developers of the program, which is us, to play a sort of not active role in implementation, but rather in capacity building for the partners. The other scaling up that is happening is with the government, where we are directly involved, working hand in hand with government, exploring how implementation happens and designing the strategy together. And that's another model of implementation that's going on right now.
Thanks, Godfrey. And I might just push you on the like government piece a little bit to share a little bit more detail, but around like how did that relationship form and how have you managed to build their confidence and begin working together, as that can often be the hardest part.
It is, yeah. But as I said, right from inception of the program, we had government present in the form of members of the advisory committees. So they were present in looking at the development of the intervention right from the start. We would check what is government perspective, what is government policy. And in that way, the senior officers who were involved at the start of the PFR were able to make government input felt there. But we also realized that we cannot do any scaling up without strengthening systems national level. At the level of was kind of new, and we knew that that is what we had to do, to bring this conversation to the government, to say, look, there is increasing demand for evidence-based interventions. And this was quite a challenging engagement, because for government officials, they're used to saying what is there, what can government invest in, but then the issue of evidence, what kind of evidence, was really an important discussion. The other thing that was missing at the level of government was, just the capacity to bring together different actors and to have a voice that is talking around, coalescing around the issue and building a voice around parenting work. So fortunately for us, we had another grant which we used to set up together with government, what we call the Uganda Parenting Agenda Initiative. So this brings together different partners who are working in the field of parenting. And being at the center, we took advantage of this and often presented, one, the issue of evidence, and secondly, what are those interventions that are existing. So the Parenting for Respectability got leverage at that point as well, and being talked about as one of the existing evidence-based interventions. And of course, we supported government to carry out a mapping of existing interventions in the country, both homegrown, evidence-based, and those that are coming from abroad. So by the time we started talking about scaling up PFR, the government officers were quite comfortable. They would understand the difference between lack of evidence and evidence-based interventions. They had the systems, and we're building tools together for monitoring and for coordination work.
Thanks, Godfrey. That's so helpful, and I think that level of detail will be useful for those that are like interested in understanding more about what scaling the government might look like and how to begin that journey and those conversations. Anna, I wanted to come back to you to maybe share any other reflections that you have, but I guess particularly to understand, like, has the approach that you're team is taking now you're thinking with like a more scale first mindset and a more kind of problem solving mindset changed, and I guess what are some of the mindsets or the actions that you're taking that feel different now you're on this journey?
Absolutely. I think this whole journey has really transformed the way that we think, and I cannot stress enough kind of how important it has been to realize that you don't have to have the perfect thing in order to sort of start the scaling journey. And it's been I'm sure Godfrey is still learning along the way, even though you've been on this journey for 10 years now. But I feel like that has been such an important lesson that we've learned. Um, you know, you're building it as you go. Like, of course you need to have something worthwhile, but like I said, if it's an idea worth sharing and if it's a good idea, I'm certain that it'll be worth kind of starting to think about the bigger picture, because I fear that if we kind of wait until we have the perfect thing, we'll be here forever, and never kind of ready to launch it and to start scaling. So that's just something that's really been on my mind, and I'm really happy that kind of we we found spring and we were able to learn all of these things and understand that you don't have to have something that you've been doing for 20 years in order to start kind of dabbling in the scaling journey. So that's just something that I wanted to share.
Yeah, thanks, Anna. And could I maybe just ask you so that it feels more concrete to the audience? Like, what are some of the milestones that you're working towards? I know that there's sort of translation into other languages happening, but maybe anything else, the kind of the ambitions that you have.
Yeah. So kind of big picture is we have the self-help program. It's currently available in a couple of languages, but our idea is to make it available to basically as many people around the globe as possible. So the concrete steps that we're taking is we're translating the self-help program into, first of all EU languages, but then of course beyond, because we want it to be accessible to the majority of the globe, essentially. So that's what we're doing right now. Concretely, we're translating. We're setting up a website, or we've already set up a website, but we're actually like bringing the self-help programs into this website. And then, like I said, we're finding partners locally to actually get the program into different countries and different cultural contexts, so that people are actually finding it and using it. All of this to enhance prevention of sexual violence against children.
Thanks, Anna. I think that's really helpful. Appreciate that. And so what I might do is, I know that we're coming up to 20 minutes before the close of the session, and I know that there's been some Q&A questions popping up, but give people a moment if there are burning things that haven't been answered, or particular questions that you want to know about each of the solutions, or questions for me about some of the concepts that I've delivered at kind of pace during this session. Please do pop them in the Q&A piece of the bar below rather than in the chat, and we'll be able to start answering them. And Jane, I might hand over to you to begin moderation if that makes most sense.
Sure, thank you. Thank you, Godfrey and Anna and Amy. I hope you can see from the chat alone how engaged people are and how they're really hungry for this information. It was very telling to me before we start the Q&A just to listen to Anna and Godfrey that there might not be a perfect time to scale up. You know, I think Godfrey used the term building the plane as you fly it. And Anna, you said sometimes it's a light touch to start, right? Like it doesn't have to be a huge push forward in the initial scaling process. And I think that is, refreshing, because it's ominous to, you think you have to find the exact moment with the exact partner and the exact pathway. And sometimes you just have to move forward with a plan, right? And be agile and adapt and bring people along the way in the scale journey. So I thought both of you articulated that really well. So I know people are still putting some things in chat. So Amy, if you get a chance to look at that, but I am going to go to the Q&A now. And then I think between the three of you, you decide who wants to take the answer, or you all may want to put your perspective. So the first one comes from Anne, and she said, I would love to hear expert perspectives on how scale and sustainability interact, particularly when we think about institutionalization as a mechanism for both.
That's a toughie, and I think we've spoken a little bit about sustainability and funding at scale, and I shared that link to the securing funding for nonprofits into the chat. I think the links will all be collated again, so you'll have them via email. But I might start, and then Anna and Godfrey, if you're inspired, feel free to jump in. But we see scale as the ambition to create an impact on the problem, make a meaningful dent in the problem, by, as I sort of said, through either increasing the number of solutions or the amount of people that are reached by solutions, or kind of reducing the problem by changing cultures, society, influencing policy, things like that. I guess where sustainability really interacts into that big picture is really thinking about how do we have the operational capabilities to deliver something successfully year after year. So the right skills, the right staff base, the right knowledge in those staff bases. And then the kind of the big question, and always the big challenging question, is who is paying for that ultimately, and why are they paying for that? And are they invested in paying for that? And that might be a diversity of payers, and that could be your beneficiaries paying a small fee, that could be big philanthropy paying into you, that could be government, that could be other sources as well. But yeah, that's the kind of foundation that needs to sit to help you achieve scale. And then a lot of the time it's testing and figuring out who are those people that are going to deliver alongside you and maintain that like operational base of resource and ability to keep this thing going year on year at the size that we need it to be, and then figuring out who's going to pay. And we tend to call those people doers and payers. And again, in our toolkit, have a look. We've got tools on exploring who the right doer and payer might be for a particular solution, intervention, service, product as well. I'll pause though to see if Anna and Godfrey, there's anything else you want to share on kind of the interaction between scale and sustainability. I'm not an expert in institutionalization, so I'm not going to answer that bit, but we are working in Bulgaria on preventing family separation and working alongside institutions if that's relevant. So do take a look. Our program is called, oh gosh, I can't remember what our program is called. I'll link it in the chat, let me find it. But we do have a program based in Bulgaria thinking about this. But Anna, Godfrey, yeah, anything that you would add?
No, I think that you have said perhaps what also resonates with me. It's really difficult to think about the interaction, but certainly we come to believe that embedding these programs in the government services is really the way to go, because it guarantees sustainability in that sense. But I would like to think about sustainability also in another way, that in the era where we're discussing the value, the importance of parenting, I think it's important to sustain the conversation around this. And for us, for me, that's a key area that I have been really proud to have contributed to, sustaining the discussion, sustaining the number of people at the highest level who can speak about this issue. And that's why we have invested a lot of time in developing the National Parenting Agenda in this initiative, with thought leaders, especially at the level of government, who will continue with the conversation, with the debate. Because if this debate dies down, because as you know, things have their own seasons. Sometimes it's because of a political season or something like that. But if we have people who continue to talk about this at government, then these people are able to keep the fire burning with respect to how government prioritizes and allocates. So champions, I think, how do we sustain the champions at the national level as they impact sustainability, allocation of resources, as well as promotion of evidence-based interventions like the Parenting for Respectability?
Brilliant, Godfrey. I think that's such a relevant and an important kind of piece to add. Thank you.
Well, similar along the line of engaging leadership, there was a question about how do you communicate with senior leadership about the need to scale if they're not aware of the concept or aware of the approaches, or
Well, Brianna, I might it to you both as you're living that at the moment.
Should I go or is that Anna?
Go ahead.
Okay, thank you. Let me try. Certainly, one thing that we come to realize and appreciate that we do not have answers for all these things, and we do have others who know something about and who who share the same vision. So in a view, what and an experience, what we did was first of all to understand the policy context and to take advantage of it, and to become the go-to person. So you brand your organization as and sort of a credible institution with evidence, with expertise in this area. And that always means that the government officers will look around and say, who is able to speak, who is able to come to me in a meeting where there's a conversation of this kind. And then, like I said, creation of an agenda that brings together different people into a consensus sort of platform for us, the game changer. The opportunity that came to the government officers was that when they called a meeting through the national agenda for parenting, the different stakeholders came and they shared experiences, they shared learning, and there was demand from the different partners, which would be placed directly to government sometimes, or government would also ask about, what is evidence? And then we would have an opportunity to clarify. So we took advantage of the windows of opportunity to within the current horizon and try to shape the conversation around that. So become the sort of what I call the usual suspects. The government will know there is some organization that is making noise about this issue.
I just wanted to add, I think it's really important to kind of understand and communicate that you can't do everything yourself, and you need sort of you can't just keep growing. So referring back to what Amy was talking about, growth versus scale. So sort of like finding those ways in which you can actually kind of bring that stretch or that solution on a bigger level of scale. So I think it's not just a matter of growing and growing and growing. It's a matter of finding a way that works for you. And I mean, the resources, Amy, you've shared today, I think they're very useful, and just sort of communicating that that there needs to be a way that those solutions can be, scaled at a bigger level instead of just focusing on growth, I think.
And I might also just ask you both to bring it into the more micro, internal level as well, because I think those are really helpful reflections to thinking about the bigger picture. But then, how do you also build buy-in in your teams? How do you get people excited about this ambition, which is sometimes scary, is sometimes big, is sometimes very future focused, and I guess board level and kind of delivery staff level? Yeah, Anna, go for it.
I think, I mean, like I said, you can't do everything yourself, but at the same time, you're trying to solve a big problem, whatever it is. So I think you get the buy-in by basically saying, we can't do this ourselves. We need some sort of way to scale this on a bigger level. We need a lot of people around the world involved. And I think the idea of being able to move forward in a whatever it is that you're trying to solve, in our case, preventing sexual violence against children, we're trying to reach as many people as possible. So within our team, it's very exciting for all of us to get to find ways in which we can engage others so that we can get our solution to as many people as possible.
In our case, I think, first of all, we have maintained kind of a relatively stable team, small, but there are a couple of people who have been there right from the start. So that's helpful because we all know where we came from, and we all hold the program so strongly. And so it helps us moving, going on and seeing how it's developing, how the interest is taking the program different places. So there's that internal motivation, but also designating specific sort of champions within the program on specific roles and say, this is you, we would like you to be leading with communicating with the partners or going to meetings and, you know, being able to think about what is going on now. And so opportunity to everybody. But most importantly is about being very, very clear that we are not building something for today, that we are all contributing to something that is really, really helpful and is going to impact so many people's lives. And these people find meaning in having to contribute to what changes people's lives. So as staff, sometimes the salaries are not so attractive there, but people are there. Everybody's working so hard. Thank you.
Well said, both of you. Very well said. And you know, one of the challenges or positives is that it's hard to argue against data, right? And evidence. So I know you shared, Amy, the Spring Impact Scale Readiness Diagnostic Tool, and I'll make sure we have that in the follow-up as well. But you know, the question came a couple times, like what level of evidence is really required to demonstrate that it's, you know, the impact of the solution and the readiness to scale?
Yeah, and this is a question that we grapple with a lot, and I don't think there's like one size fits all answer. But what I would say is we would not encourage an organization to scale something that they aren't confident works and they have some level of internal and or if possible external evaluation, data, feedback that suggests that it is making a difference and that difference is useful, meaningful as well. And the reason I say that there's sort of like not one perfect answer to this or one size fits all answer to this, because that evidence might look really different for a complex health intervention versus a different type of intervention. The other thing to say is if you then think about who ultimately you want to be funding your solution at scale or supporting the delivery of your solution, they'll have different evidence requirements to buy in and feel confident about taking this forward. So government being on the more maybe strenuous side of the like level of evidence and impact data that they need compared to maybe training other kind of teachers, for example, or working alongside NGOs. They might not need to see the kind of cost benefit analysis or RCT style level of evidence that you might need to build over time. NGOs might be more happy to see your external evaluation or internal kind of feedback mechanisms. But what we do say is that, yeah, you need to have confidence it works, and that this level of confidence needs to align with those that you want to work alongside as you scale.
Could I just add very
Of course,
briefly?
Godfrey.
Yeah, not just to agree with Amy on all those. You may not have the rigorous RCT data or evidence, but it's also very critical to show that the intervention does not harm the people, that there are no unintended consequences, and that you have reflected on this and they keep assuring the people who are taking the intervention.
Anna, is there anything you'd like to add with your project? What kind of, you know,
Yeah, no,
evaluation did you have when you made the decision to scale?
yeah, so like I shared earlier, we're currently in the process of evaluating or two separate scientific evaluations of the program, one of which had already started when we started the scaling process, but neither one of them have been completed, but there are positive preliminary results. However, like I said, we once we launched our so first of all we piloted our program, but after launching it to the wider public, ever since then we've been collecting feedback from the users, and from the over 200 responses that we've collected, we see a positive trend for kind of supporting behavioral change. So we took that as a very positive sign, but of course we want to make sure that it's also scientifically evaluated, and therefore we've embarked on these two separate evaluations. But I could not agree more with what Godfrey as well kind of said, that we need to make sure that it doesn't harm the people. So that was a really important addition.
And Amy, have you found that some things that are effective on a small scale do not have the same impact when they're brought to a broader scale? Or do you find most things, don't have success just in a vacuum? Most things that are impactful and have, a positive evaluation can in fact have some level of scaling?
Yeah, no, Jane, I think that's a brilliant question. And I think actually what we find that comes down to, and I think that's with all forms of scale, is that we can't take a cookie cutter approach. And Godfrey will know that as their work is moving into different countries, that although we know the kind of core elements of what we do creates impact, and we've proven that, and we might have evidence for that, we still need to be really, really careful if we're taking this to a new community, a new location, a new setting, that we are still being really mindful of the cultural context, the differences that occur in there. And so that's often why we also think about scale through partnerships, because if you're working then with an NGO or a representative in that location, they often know that setting so much better than we do, having originated this in a particular city in the UK, for example. And so we tend to say, as long as the impact for the kind of core of the solution is well proven, the kind of bits that sit around that can be flexed to better suit the context, and therefore that allows it to maintain impact but be like contextually and culturally relevant as it scales into new locations. Obviously, not everyone's ambition is to scale to new locations, and it might be to deepen impact in an area, or to work with actually different types of audiences. We've spoken very much about scale as in reach, but there are other ways to think about scale too. But that's what I would share. I don't know, Anna, Godfrey, if there's anything that you would add.
I'm glad you added the
Yeah, no, just to agree, actually, for us, that is why, sorry, I was just saying that is why it's important to continue to do evaluation, even not just the processes, but also whether the intervention remains effective at scale.
Yeah, definitely, Godfrey. So continuing to test and to learn, exactly. I think just because you've done an evaluation once 3 years ago, or you've looked into this at that point, doesn't mean that the same impact is going to be created now. So yeah, we really encourage organizations who are scaling solutions to fall in love with the problem and not the solution, and be really willing to adapt, change, evolve the solution year on year to ensure that they're still solving the problem, meeting the needs of their beneficiary, rather than having the perfect solution written out, drawn out in a brilliant manual, and that existing every year and always being the thing that scales. That ultimately may not then end up creating the desired impact. So being, as Godfrey says, flexible to evaluating and learning ongoingly is really important.
That's a great point. If you look how dramatically the world changes, whether it's AI or, pandemics, or, I mean, all of our ability to shift has got to be there in everything we do. Thank you for hitting the cultural component, because Asha had asked that as well, like what cultural barriers did you bump into when you went to scale up, or were there any, or something to be cognizant of? And then there's a question, it says, all developing and undeveloped countries, the women are somewhat seen as a second-class citizen. So there's difficulty in programs that are given, sometimes programs give preference to the male child as opposed to the female. Like, do you bump into any of those components when you go to scale up? And
brilliant question, and I know Godfrey's just dropped off, but Anna, I wonder whether we can think about this in the view of working in topics that are sometimes taboo or culturally sensitive, or having to tackle kind of a public narrative, and I wonder how, maybe from your perspective, scaling and working in that environment might bring some challenges.
I mean, just sort of from my own personal perspective, I'm a lawyer focused on children's rights and international criminal law, but from that sort of perspective, I always think that each child is, protected under the same rights, and each child has to have the same rights dependent on their gender. So I would just kind of I understand that that's not how it always goes, but that's my perspective, that each and every child should have the same protections. And that's something that we all have to strive towards.
Well said, Anna. And then there's a question about I believe the cohesiveness of a team as you move forward and priorities. It says a challenge with training that we found is to ensure that the team agrees on what measures and indicators of change will be tracked and whether training changes practice in concrete ways. Like, how do you know the difference and what seems, a useful question, and really just that team being one cohesive, thought moving forward or plan.
Yeah, definitely. And I think that can be really, really challenging. And I'm not like an MEL expert, and I'm not gonna pretend to be. But I think something that we have important conversations with those that we support around is not measuring everything, basically measuring what is going to be the kind of most important thing and the most meaningful thing to be able to see that what you're doing is making a difference. And that might mean having to do a little bit of a theory of change-esque work, figuring out what is the problem that we're wanting to solve and working back from there. But I think something that we do find is that organizations can sometimes get themselves into a little bit of a trap of trying to measure absolutely everything and then getting bogged down in collecting and sifting through that information. So there's definitely, and I know I'm not fully answering your question because I'm not in your conversations and I don't know the challenges that you're facing, but there is definitely an important piece to be done in really thinking critically about what is it that's important to measure and find out about, and what's kind of like nice to have in that, and we don't need to know all of the answers to have confidence that this is working, and spend lots and lots of time collecting that data. Similarly, because it burdens also those you're working alongside to have to input all of that information, or those trying to deliver to fill in all of that information. And again, aligning with your team, I think that's being really transparent about the goals that you're aiming towards, the problem that you're trying to solve, and building really great alignment around the interpretation of why your solution exists and what your ultimate aim is. Because actually that can sometimes be the hardest thing. If your whole team isn't aligned around the problem you're trying to solve, you could all be coming at it from slightly different angles and interpretations.
Does the scale readiness diagnostic tool help teams work through this and organizations work through these issues?
So not the scale diagnostic, but in our toolkit, there's a whole scale strategy section. And one of the components in that is how to create your problem definition and how to define your intended impact. And those sort of sit side by side. So if you actually, once you've really defined the problem that you're trying to address and solve and make a dent in, that's kind of the first step. And then in doing that, what is the impact that you're intending to create to get there, and how does that then reach together? And that can be really helpful.
And then combined, and I'd love your perspective on this too, is there were a couple questions about pathways. So I'm going to try to combine them. Just, do people combine different pathways or certain elements in scaling? So it's not just, this is my direction and this is the only pathway I now take. Can they do multiple? And is there some that have been more cost effective when there's limited resources?
Yeah, so we definitely say like you don't need to kind of pick a pathway and that's your only pathway. We definitely find organizations might hold a combination of multiple. That might be like training and then working in partnership with other NGOs. That might be partnership with government, but also like lobbying and campaigning and creating kind of movements. So yeah, we really do see multiple pathways interacting at once for some organizations. There's obviously a limit to this holding too much, and again, like with then investing kind of too much resource in it becoming complex. So there's a balance. The other way that we can see it playing out is that your scale pathway evolves over time. So it might be that you start working in partnership with NGOs, but you are doing that to build an evidence case and enough of a momentum to influence government to then work in and have government adopt a solution. Or you might be doing kind of something else and then move to a point where actually your role is now only lobbying because the training is being covered by schools, for example. So those pathways can evolve over time. In terms of cost effectiveness of training of scale pathways, the like very sort of like frank answer, if I was to sort of write it on a test, is open sourcing is the most cost effective way to scale. And essentially that means packaging up all of your resources and making them freely available online, and then stepping away and saying, I've got nothing to do with it, but I know that people are using it, and it probably is doing good things somewhere and hopefully being used in the right way. So Alcoholics Anonymous is an example of a kind of like an open source toolkit that's used globally. And we don't really even know who the true originator of that was. But that's kind of hit scale where it's like a synonymous brand. So typically the pathways that are more cost effective are those that involve where you're more willing to give over your solution with less involvement from yourself, because then there are less costs to you in training, quality management, upholding the success of that solution.
And I'm trying to visualize the list of pathways. I don't, are any of them engaging like grassroots organizations, like within a community that might have a similar but not same mission, and then kind of building your pathway through this collection of these local grassroots organizations?
Definitely. So when we say sort of working in partnership with NGOs, that could be working with NGOs that are bigger than yourself because you want to capitalize on their reach, but it could be also, as you say, building a coalition or collective of others that are working in grassroots settings or in similar communities, but don't have this service or program available yet.
Perfect, thank you.
I
feel like
I was going to say, Jane, I'm conscious of time, and some people are willing to stay on, so I'm leaving that to you. But I did just want to flag.
Well, and I feel like we've, there's a lot of questions about engaging government. Godfrey did a great job of talking through that. There was a lot of interest, Anna, for you people wanting to engage yourself and Godfrey, and maybe ask, learn more about your programs or learn more about your personal journey. So I'm going to leave that up to you, whether you'd like to put your contact information
Absolutely,
in chat. So, because I know that you've made yourself incredibly available today. So but I know that there's a big interest. And just so everyone knows, we've also linked Anna's organization and Godfrey's organization, and of course, Spring Impact on the webinar page that the recording will be on. We'll put all the resources on there. So you should have everything that you need or can take away from here in one space. But I guess, because to kind of wrap up, because I do want to be really cognizant of everyone's time, Amy, Anna, what takeaways do you have, or what are those parting words of wisdom? I do want to apologize to anyone who we may not have gotten to their question. Amy has very graciously given us the contact information for Spring Impact, so feel free to, if there's a question that didn't get answered, to contact them directly. And then there is a survey when you disconnect. It takes just a few minutes. We do really listen and adapt, but you can also put any information in there for Anna or Godfrey or Amy, and I'll make sure that I get it to them from that survey. It'll come up when you disconnect from Zoom. So now with that, I will turn it over to Amy and Anna for any parting words.
No, thanks, Jane. And I think my parting words really are that in thinking about scaling, you want to think about it from the outset, and you want to be thinking about it with a problem first lens. So not taking your solution and making that massive, but really thinking about how you're going to make a dent in the problem. And going back to that sweet spot to scale as I described, and really thinking about, well, does it create value? Does it create impact? And how are we going to sustain this? And if you're thinking about those three things kind of consistently as you work towards your journey, then you're really likely to kind of fall in the right direction. And hopefully Anna and Godfrey, and hearing about a couple of case studies, has given you food for thought about kind of what might be useful to take as next step to think about this. But yeah, Anna, I'll pass to you because your takeaway might feel very different.
Mine is very, very sweet and short, but like I said already, I think sort of not waiting for the perfect moment. That's one of my biggest learnings thus far is to not wait too long. And I mean, of course, like we spoke already, you need to have a valuable resource and you need to have some proof of it working and you don't want to cause any harm, but there is no perfect time. So I think to just sort of be brave and trust the process.
Thank you. Well said. And I just like to end a little bit on why is scaling important? Like, for our organization, why was it important for us to host this session and to get, your insights and your wisdom out there is because, we are all, if we're really going to move the dial on child protection, then we have to find effective, solution-driven programs that are evidence-based and strongly evaluated, and we have to get them out on a larger scale, right? Like everyone has limited resources, everyone has limited manpower, and when these programs are out there in vacuums, and there's all this duplication of effort because everyone's trying to create their own version of a program that, could be a gold standard. Scaling that is so critical to move the dial forward. So that's why it was important for us to host this session and to highlight the great work of Spring Impact, to highlight the great work that you're doing, Anna and Godfrey are doing. So I strongly encourage you to visit Spring Impact's website. I mean, there are some amazing resources on there, and we just briefly shared links or briefly touched on them. But, as you're asking yourself these questions, like, is my program ready to scale? I think you'll find some incredible diagnostic tools on there. They have, I think it's, what's it called? Scale Mail. So there's even like weekly tips that come out and insights, and you can subscribe to that. And I really strongly encourage you to visit their site. And I want to offer a sincere thank you to Anna, to Godfrey, to Amy. This has been a really powerful webinar, and to our audience for being so engaged. So, and again, if there's any questions we didn't get answered, please feel free to use that Spring Impact info email. And I'm sure that Amy and team will get back to you.
Thanks so much, Jane. Thanks, Anna, and thanks all for your engagement.
Thank you so much.
Thank you. Goodbye, everyone. Have a great morning, evening, night, wherever you may be. Good night.
Bye all.
Bye.